Ladies and gentlemen, boys and girls, I think you'll find our afternoon program really extraordinary and and really an interesting mix of all sorts of different perspectives. So with that, we normally focus on the business side of pediatric primary care practice. And that said, we don't normally talk about medical topics, but given the impact of this surge of a triple epidemic and trying to sort of plan for what's coming down the road and how many appointments are we setting up for checkups and this, that, and the other stuff, I just wanted Roberta DeBiasi, who's our chief of pediatric infectious disease at Children's National, to just provide a little bit of framework about what's been going on with all these viruses. She can't predict the future, but she can at least help us sort of understand where we've been, where we're at, and help us sort of plan for these next couple months.
Thank you so much for inviting me to this meeting, which I actually find really interesting because I don't get to go to this type meeting very often. And I was joking, I don't know about you guys, but my picture before the pandemic, which is here, I look a lot different now. I'm tired. So I'm just going to give you a little bit of an update. And you all on the front line could be giving me more of an update on what it's really like, but I'm going to give you more of the data part of the update. And, you know, as you've heard, RSV, SARS-CoV-2 virus, and influenza were the three that just reared their head with sheer abandon in the last few months. So I'll just start with what, you know, every time I give an update, we just talk about COVID first. And I hope you can see my cursor here. So this is the whole pandemic. And this was the Omicron spike, which, you know, happened earlier into 2022, and we came down. And then really since then, we've had some increases and decreases, but, you know, to the extent of the original Omicron spike, we have not had anything like that as far as volume. But we have had an increase of volume that you appreciated in your offices. And right now we're kind of at a spot where we're watching very carefully about this other Omicron variant, which I always have to look at the letters at this point. Now it's XBB.1.5, also called Kraken. That's easier to remember. And right now it's it's about 2/3 of the cases in the Northeast and about 1/3 of the cases in the U.S. as a whole. So it's very transmissible. It evades vaccine, but it actually the new vaccine, the bivalent vaccine, does provide significant protection. So far, I'm not that concerned about this new variant, but we'll just have to see what happens. And then you all, I'm sure, got this health HAN warning on November 4th that there was increased respiratory virus activity occurring. And that was really important, as I'll show from the pictures, that for a while there was literally nothing. And I remember early conversations early in the pandemic, we were wondering, like, could there be co-infection, because we were trying to figure out how to strategize our testing. And essentially there was no co-infection, even early on when COVID first emerged. So we were coming up with all these cool scientific reasons. Why is it a receptor and it's blocking and all this great stuff? But, you know, honestly, as soon as we took our masks off, it all came back. So it wasn't that scientifically interesting. And so this is just showing you a graph about U.S. influenza activity nationally from the CDC surveillance. And this particular line here with the red triangles is the current season. And you can see it was just earlier and really high compared to the last 5 seasons. So there was really only one other season in 2017 where it got that high. And it just really came on very strong. But the good news is it's definitely on the way down. So I don't know if you've seen that in your practices. We've definitely seen that in our local data at Children's, and I'll share that with you in a moment. And not only was it a lot, it was severe. So if you compare now, the red line is 2020 this season compared to the prior 5 seasons. It was a large rate of hospitalization compared to other years. So severe early. And, you know, the theme that will come through is if you have no exposure to other viruses for a couple of years, it does make a difference when you get exposed to it, you know, how you react to it. And then RSV. So the hospitalization rates for children under 5 were more than twice as high as any season since 2018, 2019, which is when CDC started tracking the data. And again, you can just see, you know, the 2019, 2020, basically nothing in 2021, and then that weird late, you know, small outbreak, and then boom, we just got hammered here over the last few months, but that also seems to have dropped off significantly. So, what are the possible reasons for the large surge of these other respiratory viruses? Most likely it's just this lack of circulation correlating with our easing of, measures that we know prevent transmission of respiratory viruses, social distancing, masking, all those sorts of things. Not saying it was the wrong thing to do, because we can't stay, under wraps forever. But that does lead to what we call, the immunity gap, where there's lack of immunity due to decreased exposure, particularly for the youngest infants who really had no exposure. If they were 2 years old now, they basically had no exposure to any viruses in the last 2 years. And then, though, even in the older children and the adults, their immunity waned, and therefore you're more likely to spread it to these kids who have no immunity. So that's probably the situation. And then I was just going to show you our local data. So when Mark said I don't have a crystal ball, I don't, but I have Dr. Song. And I don't know if you all interact with Dr. Song. She's our infection control chief. She day in, week in and week out, puts together these beautiful reports, which all of you actually have access to if you have access to the Children's Network. And I'll put that on the last slide. But she looks at all of our viral data and publishes it every week. And it's super valuable. So whenever anyone asks me, I always give her the credit. I say, I look at her trends and that's what I make my predictions based on. So this is a graph she makes that has all of the viruses that we test for. She took out all the other ones because they're not really big players right now. Like we don't have metapneumo and all those in this graph. So I'm just showing you rhino, enterovirus, influenza A, RSV, and COVID. And you can see back here, it was all green, all COVID, everything, all the time, COVID. But here you go now, this big burst that we just experienced, look, very little of it is COVID. Very little of it is green. The biggest part of this graph is influenza A, the orange. And then the next biggest is RSV, the kind of maroon color. The good news, again, is that it's all coming down and coming down quite quickly. But it's just beautiful to see that, visually. And then she broke out each of these individually. So here's SARS-CoV-2 infection. And here she's showing our current season in red versus last year's season. So we actually had very little bump in COVID compared to the surge that we saw last year for COVID. And this is just to remind you, we've now had like over 11,000 kids at Children's diagnosed with SARS-CoV-2 virus. We've had over 2,000 children admitted to the hospital, of which about a quarter have needed critical care support. And we have seen our census go up a little bit, but nothing like when we had the big surge in February where we had like 70 kids at a time in the hospital. And then rhinovirus, enterovirus, again, red is this year, blue is last year. So it was really kind of similar, even though we got all excited that we were seeing it again. It really wasn't that much more of a bump than we usually see in the fall. But look at this for RSV. Holy cow, what a big difference. Red, we just had this big surge of RSV compared to last year. But again, it's coming down. And then lastly, flu, same story. Big bump this year. And all of those three overlapped perfectly together, which I've never seen that in my career. I don't know about you guys, but it was something. And I'm not on the front line, but we were seeing just the sickest kids in the hospital. So, in summary, during the initial 2 years of the COVID pandemic, with all our stricter social distancing, masking, there were essentially no other viruses co-circulating. I've also never seen that before. And then since we've returned, it's not surprising that they're coming back, but I think it was a surprise to all of us that they all came back exactly at the same time. And in summary, for the last week, the total number has definitely come down overall. The only one that we see still, made a little rebound was RSV in the last week, and we're just going to see what happens there. And then we're keeping a very close eye on this new Kraken variant of SARS-CoV-2 to see what happens there. And then the last couple of slides, you guys know this better than me. It's really hard to tell these apart. You can't, any child in front of you, you can't say, oh, this one I think is more likely this or that. I think the only thing that does push you more towards RSV is if there's actual wheezing and bronchiolitis picture. But are there kids that have that with the others? Of course there are. You guys know that. So these were some of the considerations which may or may not be completely helpful to you in real life, but from healthcare providers, these are the considerations for healthcare providers that came from that notice from the CDC. Obviously we want to try to offer vaccinations against flu and SARS-CoV-2 for all eligible kids, which really now is, most kids over 6 months of age. Use diagnostic testing if you can. to help you guide treatment and clinical management, particularly in your higher risk kids, where it makes a difference if you're going to use a therapeutic intervention. And then of those kids, treat these kids with confirmed flu or COVID with appropriate antivirals. So I've listed here, Tamiflu is still the 5-day course for all ages. For outpatients with severe, complicated, or progressive illness, hospitalized kids, even if it's beyond the couple of days since their symptoms started. And you can use it for even acute, uncomplicated children if you do it early, but the benefit is smaller than these higher risk kids. There's also oral baloxavir, which is now FDA approved for kids 5 to 12 years of age, even if they're healthy. It's a single dose regimen. And in our older kids with higher risk of getting complications. And then there are these other rarely used, but also effective interventions. And then our kids that are at highest risk for hospitalization or severe illness for SARS-CoV-2, we do recommend Paxlovid, or if they're not old enough, meaning over 12 years of age, or heavy enough, meaning 40 kilos, intravenous remdesivir. And I can tell you that if you have any of those kids, please just use our pager. We'll help you get them in. We now have an outpatient infusion center for the kids up and running at Children's, where they just come in 3 days in a row and get their infusion and then go. So this again is the acknowledgements to Dr. Song and her team. This is a link that you can just click on and you'll get that report every week if you'd like to see her amazing viral stuff. And then your prediction can be just as good as mine, because it's really, just a matter of looking at trends. And then CDC has great links for flu epidemiology. So I'll end it there and we'll hand it over to Dr. Codispoti, right? Oh, sure.
Any questions?
When are we testing for RSV?
Can you just repeat the question?
Oh, this data for internally? Yeah, our internal data is only on kids that actually get the testing at Children's Hospital, like the multiplex testing. So you're right, it's going to be a sicker group of kids than what the bigger population, but it does follow the general trend in the community. Oh, as an outpatient, you're right. There isn't an intervention for RSV, but I think your testing is more to pick up the kids that have flu or SARS-CoV-2 for which you would give an intervention. So that subgroup of kids.
I'm coming.
Because there's no treatment for RSV still.
I'm trying to bring this back a little bit to the business of pediatrics, because we struggle with this in our office. We can test for flu, RSV, and COVID, obviously. And, a lot of us are saying, well, why are we doing this? It's past 3 days, or, maybe COVID just to keep them out of school. But then we see, then our patients are going to the emergency rooms and getting this massive, very expensive check every virus known to man, or that we can. And the parents are expecting us to do that now in our offices. And I guess from a business of pediatrics standpoint, where do we kind of draw the line?
Yeah, that's a great point. We actually do not do the large panel. So the multiplex panel with 14 viruses and all that stuff, we only do that on the kids that are hospitalized, or if it's like a very high risk, like a cancer patient or something like that. Everyone else gets just like you do in your office. We make a decision, like in some parts of the fast track, they'll do just very targeted one virus testing. Most of the ER, they get the 3, just RSV, flu, and SARS-CoV-2. Yeah.
Yeah. I'm semi-retired clinically, so take any clinical advice with a grain of salt. You all are experts at seeing boys and girls. And, we sometimes have that little sixth sense that says, this child just looks a little bit sicker than I'm comfortable with. And I think we just need to sort of recognize that with the surge of viruses, the good news is, miserable as it is, most kids are generally healthy, and most kids may be miserable, but they're not falling outside the expected course where there's going to be a serious complication or a bad outcome. That said, I think we're also recognizing that, every now and then there's on the news, a child with this, and this, and sometimes it's really hard to see those kids, but I think from a practical sense in busy practice, you just need to have your antennae up for who's that outlier, because they're still out there. And with the surge and the confluence of all these things at the same time, it got pretty crazy there for a couple of weeks. I know, like the stock market, you can't predict the future, but I will ask, does the curve suggest that hopefully there might be a rebound, but hopefully we're seeing these visits start to drop a bit and we can focus on the business at hand of treating all these kids and getting the sick ones in, but also catching up on all our checkups?
Yeah. I mean, I think, we were always, when I showed you those curves, when it just starts to go down, we never say anything because then, it goes, whoop, goes even higher. But I mean, now it's clearly come down. So I think hopefully we'll have a little bit of a reprieve for a while. And I guess the last thing I will say is his point about you all know when you get a respiratory virus, it wrecks your mucosa, and then you can get invasive, either group A strep or staph. And so we have seen in the hospital lots more, orbital cellulitis and kids with brain abscess and things like that. But you may have also gotten an HAN about increased invasive group A strep, which you asked me to comment on. It's still under investigation. So far, it was just from Denver, and they just saw an increase compared to the year before, but that kind of goes along with everything else. Everything was less. So it's really not for sure a true signal. But if you have an invasive group A strep, particularly like necrotizing fasciitis or toxic shock syndrome, then we send those isolates to have evaluation. They're looking into it.
We'll take these two questions. We're trying to stay on schedule, but Cindy, Robin.
Yeah, that would be a whole lecture, so we won't, but there's actually been a ton of progress on RSV vaccine, in particular maternal vaccination, conferring protectivity to the younger babies. A lot of progress on that. There's a ton of progress, so that would be a good topic for next year.
Yeah, totally unscientific, but one of our, we work with vaccine vendors, and they said, oh, we can't make your meeting. There's a big huddle about RSV vaccine. So take that with you with a grain of salt.